Welcome back to Conversations from the Couch. It's Leah Brick again, Executive Director of SASH. And today I'm here with Dr. Barry McCarthy. So glad to have you with us, Dr. McCarthy. Feels like we're old friends. We've been emailing so much lately.
Right. And I'm very glad to be here and looking forward to Seattle.
I'm looking forward to seeing you in Seattle. So you're doing two presentations for us. You're doing a regular session on coupleship. Tell us about that particular session that you're doing and the title of it.
Well, what we're going to focus on is about an integral part of recovery from sexual compulsivity or out of control sexual behavior is developing healthy couple sexuality. So we're going to talk about the use of couple therapy and focus on sex issues. And especially we're going to focus on the role of eroticism. That generally, when people think about couple sex therapy, they think about intimacy and communication. They don't think about this new mantra, and I'm going to very strongly sell this new mantra, and that is desire, pleasure, eroticism, and satisfaction. That's the core of healthy male and couple sexuality.
That sounds like it's going to be a really great session. Then you're following that with a post-conference on healthy sexuality for men. Is that right?
Correct. That generally we've got it all wrong when it comes to male sexuality. We treat it simply and in extreme ways. Either male sexuality is about total control and power, and men are more sexual than women. That's one extreme. And then the other extreme is to demonize male sexuality, to see it as causing problems in terms of compulsive sexual behavior, misuse of porn, sex addiction, affairs. And this idea that a real man is able and willing to have sex with any woman, anytime, in any situation. Both of those extremes are both scientifically wrong, but they're harmful to men and couples.
You know, when I hear you talking about both of these sessions, I think that it's going to be really important for people to attend both, because I can see how the post-conference almost feels like the post-conference should come first so that we can get that information, and then how that interchange happens with the couples and why that's important in a couple's relationship.
Right. Well, again, I'd love to have people come to both, but the one that I feel the strongest about is the post-conference workshop about healthy male sexuality. I really do believe that we have sold men out by making things overly simplistic, not understanding the complexity of male sexuality. And then one of the things that really fascinates me is how very few professionals and almost nobody in the lay public understand that when couples stop being sexual, especially after age 50, it is almost always the man's choice.
That's interesting.
That is extremely interesting, it's extremely important, and it's extremely scientifically true. And what happens is that most men, now again, I'm always into complexity rather than simplicity, but let me try to say this simply. Most men, not all, but most men learn to be sexual in an autonomous manner. In other words, he gets an erection, he goes to intercourse on his first erection, he ejaculates on his first erection. And it's autonomous in that he doesn't need anything from his partner. Now, that way of learning, I don't think it's even good for teenagers and 20s, but it's certainly not good for adult men. Because what happens with adult men, the great majority of adult men, somewhere between age 35 and 55. Now, it can happen at age 17. Sometimes it doesn't happen to 75. But for the great majority of adult men, they have a sensitizing experience. And what that means is they don't have an erection sufficient for intercourse. And that rather than understanding that's normal and accepting that, they panic. And they rush intercourse, they use Viagra, they talk about getting penile injections, with the idea that they want to return to totally predictable sex, where they don't need anything from their partner. But the reality of sex is that it is a couple experience of sharing pleasure. You want to turn towards your partner, whether you're a straight man in terms of female or gay man in terms of male, as your intimate and erotic ally, not somebody to perform for.
It sounds like some some pieces of this might be coming too from your erectile dysfunction book.
Sure.
That's a fantastic book. I've read that book, and it's really got some good information in it.
Right. And the key to regaining erectile comfort and confidence is this understanding of what biologically, psychologically, and relationally goes into having optimal sexual experiences, where you really have a sense of confidence in the sexual experience. But I'm an old psychologist, so I was around when Bill Masters did workshops. When I was a 30-year-old psychologist, I went to see Masters. And I walked up to him with an article about erectile dysfunction. He's a very outspoken man. He threw it in the garbage can. He said, "That's lousy science." Then he looked at me and he said, "Do you know how you can be sure that the man is cured of erectile dysfunction?" It's like God speaking to this 30-year-old psychologist. And he said, whether it happens once a year, once every 10 times, or once a month, when he doesn't have an erection sufficient for intercourse and he doesn't panic, he's cured. So the concept in terms of males is to accept good enough sex, which means most of the time, sex will flow from desire to comfort to pleasure to arousal to erotic flow to intercourse and orgasm. But when it doesn't flow, rather than panicking or apologizing, which is anti-erotic, you turn towards your partner and say, "This might not be an intercourse night, but we can have a good time sexually in terms of sensual and erotic experiences." What the man wants is he wants to go back to totally predictable autonomous erections. You cannot do that. But what you can do is be a better sexual person, a more pleasure-oriented partner, and really enjoy yourself and your sexuality.
Communication is so key, it sounds like, in this process. And you've talked about it sort of through the fringes, but why do you really believe that both of these topics are important to sexual health?
I think they're crucial to sexual health. That what you want the clinician to do is to be a pro-male, pro-female, pro-sexual, pro-couple clinician. And the reason that I, especially in that pre-conference workshop, that I emphasize is about couple therapy, is when you are in couple therapy, you get better results therapeutically, but the biggest thing is you get much less relapse. Sexual problems have very high rates of relapse, and you build in an individualized relapse prevention program with the couple. So not only will they change at that time they're seeing you, they will maintain and generalize their changes. And it is, the sex is a very paradoxical thing in terms of health. And when sexuality is healthy for the individual and couple, it's not a major factor. We talk about it as a 15 to 20% factor that allows you to feel desire and desirability and to energize your intimate bond. That's the healthy role of sex. The paradox is when sex is dysfunctional, when it's secretive, when it's shameful, when it isn't communicated about, when it becomes a pass-fail test, it takes an enormously powerful negative role. It really negatively impacts the man and really is destructive and demoralizing for the relationship. And that's what happens with compulsive erotic control sexual behavior, is that it isn't part of the man, it isn't part of his relationship. It is a shameful secret that controls him and his sexuality.
I gotta tell you, I started as a therapist a long time ago, 1986. And in my training and in all of my schooling, I don't remember ever being taught about healthy sexuality. And I was a chemical dependency therapist, and gosh, it certainly is important in a recovery lifestyle, in any recovery lifestyle, but certainly in a coupleship relationship, in a relationship with yourself, you have to appreciate and understand your own sexuality and I really hope that therapists today are getting the education they need to
They
have
are
the
not.
comfort level. I know,
They are not.
and it's unfortunate because therapists need to have a comfort level with speaking to their clients about healthy sexuality. And here I am. I've been in the field for 40 years, and I'm just now getting this education. I don't do therapy anymore, but
Mhm.
but my world has shifted since I started working with SASH, because I'm seeing how this is so important for all clinicians, not
Right.
just a sex therapist, or not just
Right.
a sex addiction therapist, or a compulsive sexual behavior therapist. Whatever that model is that you use, you need to talk about healthy sexuality.
Right. I taught human sexual behavior at American University for 50 years to undergraduates, and it was really a good experience for them. And I really loved the teaching. That's why I love doing workshops. I really love teaching professionals and interacting with professionals. But, and they have American University has a great PhD program in clinical psychology. Do you know how much there is in couple therapy or sex therapy? Zero. There's not a single course. And that has become the trend, so that sexuality is actually not being well integrated in mental health training and mental health treatments. And that's one of the goals that we have in these workshops.
Well, that's the fortunate thing for SASH, is we really get to bring all of this information to therapists and help people learn what healthy sexuality is, and present people like yourself, experts in the field.
Right. And the new mantra sexually, which I want to repeat, and I'll repeat it in the workshop, is what people used to believe about male sexuality and female sexuality too. It was very simple. It was all about arousal, intercourse, and orgasm. That was the definition of sex. That is not the definition of healthy sexuality. The new definition of healthy sexuality, again, is this mantra of desire. Healthy sex is about pleasure. Eroticism is integrated into the relationship. When it comes to compulsive sexual behavior and sex addiction, or out of control sexual behavior, depending on what your verbiage is, so many men have a contingent sexual self-esteem and a contingent sexual relationship. They basically say, if you knew this about me, you would not love me and respect me. And it's a terrible way to live with a contingent sexual self-esteem.
Mm-hmm.
You've really got to integrate your sexuality into who you are as a man, who you are as a couple.
Well, I'm really looking forward to these sessions with you in October. I just remind people that they will get you in the regular conference, and if they want to attend the post-conference, that's a separate fee, 4 hours, $79, they can get that. And certainly they can find you lots of other places. So you have a fantastic website. Why don't you give us your website address so they can go there?
So the website is mccarthyonsex.com.
And you have just a whole library of books, many fantastic books, so people can get those.
Well, the most important of the books for men is our new book called Contemporary Male Sexuality, that presents this new approach to male sexuality.
And I think we're planning on having that in our bookstore, so hopefully people will be able to get that there at the conference.
Or I'm going to bring along some copies if you would like to have an autographed copy.
That would be fantastic. Well, thank you so much for your time today, Dr. McCarthy. It's been wonderful to speak with you. And I know that these 2 workshops are just going to be such a wealth of information for our clinicians. Thank you again.
Thank you, and looking forward to seeing you in Seattle.